cancer, guys, and this is your Dr. Peterson, and I come to you because of public demand for the topic of cervical cancer in women. That many people have been asking me questions: what causes cervical cancer? Some people have been asking me, how can I test? How can I be tested of cervical cancer? Am I at risk? Which age is at risk? Which are the things that I can do and be at a higher risk of getting cervical cancer? And because of this demand, I've decided to make this video to talk about cervical cancer in women. And cervical cancer is a cancer that affects the opening of the uterus, which is the cervix. That small opening of the uterus called the cervix, I think that is the best language to use for anybody to understand. That cervix sometimes can be affected by a certain virus called human papillomavirus or HPV virus. And once HPV virus affects the cervix, then the cells of the cervix are able, or they become vulnerable to changing, to mutation. They start changing after some years of infection of HPV virus, which comes as a result of intercourse, as you're going to see. That virus is able to cause mutations or metaplastic changes in the cervical cells. And once that happens, then the cells of the cervix starts dividing abnormally. Mark, you know that once you get infected with HPV virus, which I said comes as a result of mainly through intercourse, through sexual contact with a person infected with HPV virus. And Mark, you know that many men in the society will have a HPV virus. A certain percentage of more than 50% of men in the society will have the HPV virus, which is not symptomatic. Just like COVID-19, the HPV virus is not as symptomatic, And so you find that this virus is so stubborn, just like COVID-19, HIV, they don't have treatment, so it cannot be treated by any medication. And so what we do, we normally try to do with HPV invades, we can only try to improve your immunity, or if your immunity is fine, you're going to clear the HPV virus from the body, and the HPV virus will not affect your cervix. But in an event where the HPV virus persists in the reproductive system, and I said, contact with a person with HPV, if you have many contacts, that's why we normally talk of many sexual contacts, the higher the risk of having HPV infection, which will later lead to mutation of the cervical cells and thereby cause cervical cancer maybe in the future. And that's why there is the essence of screening comes, because almost every woman of reproductive age have come across a man who has a HPV virus. Maybe you could even have one partner, but maybe they had the virus. It's not every person who have HPV virus, but some of them in the society will have the HPV virus, and especially we can talk of the majority. And so this HPV, that's why we even immunize children age 9 to 13 years, and in some countries they have higher and lower thresholds depending on their policies. But that's we immunize them against HPV virus, because if they get immunized, once they get an exposure to HPV, they're going to fight it. Just the way we're getting a vaccination for COVID-19. And so guys, HPV virus is one of the stubbornest, most stubborn virus that can affect the reproductive system. And so that's basically the bigger part of the pathophysiology of how, or the mechanism as to how cervical cancer happens in women. We have other predisposing factors to cervical cancer. For example, smoking cigarettes, taking alcohol. There are other factors, like if somebody have a family history of cervical cancer, it's a possibility that they can get another. They can get also a cervical lesion in the future, So there are genetic factors and there are environmental factors and many other factors. But one of the commonest factor, one of the major causes is intercourse. You get HPV virus into your system, into your reproductive system, and that HPV virus is able to irritate your cervical cells in one way or the other. Towards the future, the cell starts dividing abnormally, and then you get cervical cancer. But now, before a woman gets a cervical cancer, you normally develop some lesions that we call precancerous lesions. And as I wind up this first session of this topic, the precancerous lesions are the ones that we screen. That's why we screen women at least every year, or 1 to 3 years, for those who have done pap smears, and depending also on your HIV status. Mostly the HIV positive women are going to be screened yearly because of the higher risk, because the immunity is low, so their ability to clear the HPV virus is a little bit lower. That's why we normally screen them every year. And based on also on the test that you have done, we are going to look at next time maybe the test that we do for screening cervical cancer. We have via VLI, which is one of the oldest methods. Can call it more technical and manual method, but nowadays you have other better methods like pap smear, that at least after you've done a pap smear, you can repeat after 3 to 5 years, depending on the results, and again depending on the even HIV status of the person. And so, guys, I want to end it there and talk and let this topic be about HPV, the major cause of cervical cancer, which is HPV virus, and how we have gotten at how it is contacted, how you can contract HPV virus, that is through intercourse. And that's why we normally say maintain one sexual partner and let the partners be faithful to each other, maybe in a matrimony. I wanted to educate you on the major cause of cervical cancer. This is a big topic. We're going to be discussing it bit by bit, and in the second part I'm going to talk about the screening methods. And somebody asked me, is it painful to do a cervical cancer screening? We are going to be answering those questions. If you have any question concerning cervical cancer, kindly feel free to reach me out. All right, guys, so thank you so much. See you in the next lesson. Drop me a question, drop me a comment, and I'm going to answer your questions promptly. Thank you so much, guys.